Hi, this video is the demonstration of the FUT or the strip method scar, and I perform both method. Sometimes the result vary from one individual to another, and I try to provide as many examples as I can to educate the audience what's the FUE scar look like and what the FUT scar look like. So this is one demonstration of the FUT or FUSS or the strip scar. It's a linear scar where the FUE leave you tiny dots of scar. So this client actually had both technique. He had the strip method and then he had the FUE dot here. It's hard to see the FUE scar, and again I perform both FUE and FUT, and the result vary from one individual to another, and both method leave scar. And I'll tell you honestly, sometimes it's quite a bit due to patient genetics. You know, even the patient, even the surgeon trying to perform the most latest and the greatest technology technique to make the scar smaller, but however sometimes the patient genetic will make the scar smaller than it is and then make the surgeon look better than he is, and sometimes the patient genetic produce bigger scar and make the surgeon look worse than he is. So it all vary, you know, and no one's perfect, and so we try to give as many examples as we can. The strip method is you know, the down thing is a linear scar. It's hard for you to wear a very short hair style, so you can't shave it because otherwise the scar will be visible, and it's more invasive, more painful during recovery. But the benefit of the strip is very popular still nowadays, because for strip it's a lot cheaper than FUE, and the number of grafts we can do is more. We can harvest 4,000 to 6,000 grafts per day. So for advanced hair loss, most clients use the strip method. For mild to moderate hair loss, then most clients use the FUE. Although you can use the FUE for the advanced hair loss, but you're gonna need minimum of 2 or 3 surgery on average. So where the strip, you can get done most of them in one day, and there's a small area not covered, and then you can do a second one for touch-up. The other benefit of the strip is, you know, you can have good result with my work for FUE and FUT, but when it comes to compare my FUT density to my FUE, in general I mention around 5 to 10%, but sometimes I can tell that it's more than 10%, sometimes even up to 20-25%. So it varies from one individual to another, how easy it is to harvest out by the FUE method. On the other hand, the FUE is less invasive, less bleeding, less chance. It's less painful during recovery. You have tiny dots of scar where you can shave your head short without much detectability. Like this patient, he has both FUE and FUT. But the downside of the FUE is more expensive. The number of grafts we can do is less. We can do around 25 to 3,000 grafts per day. Although there are days I can go beyond 25, like 3,500. I've done max around almost 4,000. But then with the FUE, we can't guarantee the number. So sometimes, even though we set at 25, sometimes we only get 1,500 grafts or 2,000, just depend how hard it is. But you know, some patients rather have that than a linear scar. And then the other downside of the FUE, not just the price and the number of grafts we do is less, and we can't guarantee the number, is the density growth rate. Now you can have good result with good density with both, but the FUE, the growth rate is 5 to 10% less, and sometimes it's up to 20 to 25%. So this is the demonstration of the FUT linear scar. Thank you.